Hello everybody, I am the classmate that has never physically shown up to class, David Solano, and I bring to you today a presentation about personality disorders. I hope you enjoyed today's video because if you don't, I'm not going to be very happy. What are personality disorders? What is a personality disorder? According to mayoclinic.org, a personality disorder is a type of mental disorder in which we have a rigid and unhealthy pattern of thinking, functioning, and behaving. A person with such a disorder has trouble perceiving and relating to situations and people. People with personality disorders have many problems and limitations in relationships, social activities, work, and school. You and I may not realize that we have a personality disorder because that's just how you think. Personality disorders happen commonly early in life, like teenage years or early adulthood. It might be harder to tell once a person is middle-aged or older. The cause of a personality disorder. The causes of personality disorders can come from a couple different places. Your genes and environment are the biggest factors that influence your personality. If anyone else in your family has had a history of mental illness, were diagnosed with childhood conduct disorder, or something went wrong in your brain chemistry and structure, then the possibility of getting a personality disorder increases greatly. Symptoms of personality disorders. There are 10 main personality disorders when talking about them in general: paranoid, schizoid, schizotypal, antisocial, borderline, histrionic, narcissistic, avoidant, dependent, and obsessive. Cluster A. There are 3 clusters of personality disorders that we will go over today. There are clusters A, B, and C. We will go in order starting at cluster A. Personality disorders that are under cluster A are usually people that are odd, think, or behave unusually. Let's start with the A cluster of personality disorders, which include paranoid, schizoid, and schizotypal. People with paranoid personality disorder usually have a pervasive distrust and suspicion of others and their motives. They have an unjustified belief that their others are trying to harm them or deceive them. They have an unjustified suspicion of the loyalty or trustworthiness of others, as well as hesitancy to confide in others due to unreasonable fear that others will use the information against them. The perception of innocent remarks or non-threatening situations, such as personal insults or attacks, are skewed. They usually have an angry or hostile reaction to perceived slights or insults, and have a tendency to hold grudges. Married people with the paranoid disorder usually have an unjustified suspicion that their spouse or sexual partner is cheating on them. If we want to treat someone with paranoid personality disorder, they will most likely have to go through talk therapy, or more commonly known as psychotherapy, which focuses on increasing general coping skills like trust and empathy, as well as improving on social interaction, communication, and self-esteem. Medicine is usually not needed. Now let's move on to schizoid personality disorder. People with this disorder have a lack of interest in social or personal relationships, preferring to be alone. They have a limited range of emotional expression and have an inability to take pleasure in most activities. These type of people also have an inability to pick up normal social cues, have an appearance of being cold or indifferent to others, and have little or no interest in having sex with another person. To treat someone with schizoid personality disorder is also psychotherapy and group therapy, which is treating someone with a group setting where they can interact with others and practice new interpersonal skills. Medication can help cure this disorder. To finish the A cluster of personality disorders, we have the schizotypal personality disorder. This disorder is all about people who have a particular way of dressing, thinking, and have strange behaviors and beliefs. These people have odd perceptual experiences, like hearing a voice whisper their name. People with schizotypal can also have flat emotions or inappropriate emotional responses, have social anxiety, and a lack of and/or for discomfort with close relationships. They have indifferent, inappropriate, or suspicious responses to others, as well as magical thinking, which is believing that you can influence people and events with your thoughts. Finally, people with this disorder have the belief that certain casual incidents or events have hidden messages meant only for them. To cure schizotypal personality disorder, psychotherapy and medication is the way to go. Different cases need different medications.